Welcome to the YouTube channel, Dr. Mai, sharing medical knowledge. Don't forget to subscribe to the channel, like, and comment below the video to support the channel's development and see more great topics. Today we'll delve into the important topic of sleep apnea, a condition that significantly affects many people's quality of life. What is sleep apnea? Sleep apnea is a disorder that causes you to stop breathing while you're sleeping. The term apnea comes from the Greek word for breathless. This interruption in breathing can occur either due to a blockage of the airway or because your brain doesn't correctly control your breathing. When breathing stops, the resulting lack of oxygen triggers a survival reflex that wakes you up just enough to resume breathing. While this reflex keeps you alive, it disrupts your sleep cycle, preventing you from getting the restful sleep your body needs and can put stress on your heart, leading to potentially serious health consequences over time. Who does sleep apnea affect? Sleep apnea can occur in individuals of any age, from infants to older adults. However, certain factors increase the risk of developing obstructive sleep apnea. Gender and age. Before age 50, sleep apnea is more common in men and people assigned male at birth, AMAB. After age 50, the rates of occurrence are similar in women and people assigned female at birth, AFAB. Weight, excess weight, or obesity significantly increases the risk. Ethnicity. It is more common among Black, Hispanic, and Asian populations. Age. The risk increases as people get older. Central sleep apnea is more prevalent in specific populations. Medication. People who take opioid pain medications. Age. Adults over 60 years old. Heart conditions. Individuals with conditions such as atrial fibrillation or congestive heart failure. Treatment. Emergent central sleep apnea. This can develop in some people using cpap for obstructive sleep apnea. High altitudes. Living at high altitudes can trigger central apneas. How common is sleep apnea? Sleep apnea is relatively common, affecting about 5% to 10% of people worldwide. How does sleep apnea affect my body? To understand sleep apnea's impact, it's helpful to know about the human sleep cycle, which consists of several stages. Stage 1, light sleep. This brief stage begins right after you fall asleep, accounting for about 5% of your total sleep time. Stage 2, deeper sleep. A deeper stage that constitutes about 45% to 50% of your sleep time. Stage 3, slow wave sleep, the deepest sleep stage, making up about 25% of your sleep time, decreasing with age. It's very hard to wake someone up from this stage. REM sleep. This stage involves rapid eye movement and is when dreaming occurs. Typically, you cycle through these stages multiple times during a night's sleep, with each cycle taking about 90 to 110 minutes. How sleep apnea disrupts your sleep cycle. Sleep apnea causes frequent interruptions in your sleep cycle due to a lack of oxygen, triggering a reflex that wakes you up just enough to resume breathing. These interruptions prevent you from reaching the deeper stages of sleep necessary for restful, restorative sleep. The severity of sleep apnea is measured by the Apnea-Hypopnea Index, AHI, which counts the average hourly number of apnea or hypopnea events. Mild sleep apnea, 5 to 15 events per hour. Moderate sleep apnea, 15 to 29 events per hour. Severe sleep apnea, 30 or more events per hour. Symptoms and causes. What are the symptoms of sleep apnea? Sleep apnea has various symptoms, including morning fatigue, feeling tired or exhausted upon waking. Daytime sleepiness. Severe cases can lead to drowsiness during daily activities. Snoring. Common but not universal. Mood changes, depression and anxiety. Cognitive impairments, memory loss, trouble concentrating. Frequent night wakings, often unremembered, sometimes attributed to other causes like heartburn. Breathing pauses, witnessed by others. Unusual breathing patterns, such as Cheney-Stokes breathing in central sleep apnea. Insomnia and night sweats, restlessness at night. Sexual dysfunction, reduced libido or performance issues. Morning headaches, due to oxygen deprivation during sleep. Sleep apnea in children. In children, symptoms can include hyperactivity or poor school performance, similar to ADHD symptoms. Loud snoring and bedwetting, frequent in children with sleep apnea. Restlessness and unusual sleeping positions, sleeping with an extended neck, for example. Night sweats and reflux, symptoms that might be less obvious. Causes of sleep apnea. The causes of sleep apnea are varied and can often run in families. There are 3 primary types of sleep apnea. 1. Obstructive sleep apnea, OSA. The most common type, occurring when the muscles in the head and neck relax too much, blocking the airway. 2. Central sleep apnea, CSA, caused by the brain's failure to control breathing properly. 3. Mixed complex sleep apnea, a combination of both obstructive and central events. Diagnosis and tests. How is sleep apnea diagnosed? Diagnosis involves a healthcare provider asking about symptoms and history, often followed by a sleep study. What tests are used to diagnose sleep apnea? Overnight sleep study, polysomnogram. Conducted in a sleep lab, it monitors heart rate, breathing, blood oxygen levels, brain waves, and more. Home sleep apnea testing. Conducted at home but less comprehensive than a lab study, usually not for diagnosing central sleep apnea or severe cases. Management and treatment. How is sleep apnea treated? There are various treatment options depending on the type and severity of sleep apnea. 1. Conservative treatments, weight loss, sleep position changes, and nasal sprays. 2. Positive airway pressure, PAP devices, including CPAP machines that keep the airway open. 3. Oral devices, special mouthpieces that prevent airway blockage. 4. Nerve stimulators, devices that stimulate nerves to keep the airway open. 5. Surgery, procedures like tonsillectomy or septoplasty to remove obstructions. 6. Medications for central sleep apnea, such as hypnotic drugs or respiratory stimulants. Living with sleep apnea. How to take care of yourself. Lifestyle changes. Diet, physical activity, and managing health conditions. Adherence to treatment. Consistent use of PAP devices or other prescribed treatments. Communication with healthcare providers. Regular checkups and discussing any issues with treatment. Prevention. Reducing risk and preventing sleep apnea. Healthy weight. Maintaining a healthy weight can reduce risk. Good sleep. Hygiene. Practices that promote restful sleep. Managing health conditions. Keeping other health issues under control. Outlook and prognosis. What to expect with sleep apnea. While sleep apnea is a chronic condition, adherence to treatment can significantly improve quality of life and reduce the risk of severe complications like heart damage, arrhythmias, and daytime drowsiness that can lead to accidents. How long does sleep apnea last? It can be a lifelong condition, though weight loss and certain treatments may resolve it for some people. Sleep apnea is a serious but manageable condition. Early diagnosis and consistent treatment are crucial for preventing complications and improving quality of life. Remember, it's vital to adhere to treatment plans and consult healthcare providers regularly. Thank you for watching. Don't forget to subscribe to the channel, like, and comment below to support the channel's development and receive more great content.